Hi, my name is Kayla Gilkison, and I am a current second year DPT student at Regis University. I am originally from California, but I moved to Oregon for undergrad and am now living in Colorado for PT school. In my free time, I enjoy being active outdoors as well as curling up with a good book or catching up with friends and family over FaceTime. I am currently interested in specializing in pediatric physical therapy and potentially incorporating sports into that as well. I've had one 5 week clinical rotation thus far that was at an inpatient or outpatient MSK site. During this clinical, I found a few areas of focus that I think helped me be successful in the clinic, including being flexible, being prepared, engaging in my learning, and being open and willing to receive feedback. In being flexible in the clinic, having it been an outpatient site, we would have many walkover evals come over at one time, so I was always ready to either take on an eval myself or continue to manage the patients that we already had in the clinic. I think I'm also flexible in the classroom, especially when we're working with our patient cases and interventions, especially with the pediatric cases. I enjoy being creative with my interventions, and I think being flexible in tailoring those interventions to each specific patient case. In being prepared in the clinic, I was always prepping the prior evening for the day and thinking about the patients that I was going to be seeing that day and what their needs might be coming into that appointment. I would also be prepared by if we had a patient coming in for their first appointment post initial eval. I was coming up with exercises for them prior to being asked to by my CI so that I was prepared for that appointment. Engaging in my learning is exhibited by constantly writing down and asking questions, and so that I'm able to dive deeper into topics. I also use downtime during the workday to review or learn new skills, and I think that was really important for me during my first rotation. I also try to do exercises with patients that I've either never done before or don't quite understand, and I think that was really helpful in kind of understanding the whys behind what exercises we're doing. Finally, absorbing and integrating feedback into my practice was something that I think helped me be the most successful during my first clinical. My first CI had commented that I was a very coachable student as well as open to feedback, and I think that's what helped me grow the most during that first clinical experience. I like to establish an open communication relationship with my CI so it allows for that direct feedback, and I found it most helpful to receive that feedback either during a task or immediately following so that I was able to integrate it back into my next patient interaction. In preparation for CE4, I will be taking a pediatric elective course as well as a dry needling and soft tissue mobilization course, both of which I hope to incorporate into my final clinicals. Following graduation, I hope to complete a pediatric residency within 2 years and become a clinical instructor within 5 years. Thank you for taking the time to watch my video and get to know a little bit more about me as a potential student in your clinic. I would appreciate the opportunity to speak a little bit more about what I can bring to your clinic, and I look forward to hearing from you soon.